Hi
Hi
everyone.
everyone. It's hard to believe that we've been here for 6 months now in Ibba. Very quickly on, we discovered that two areas of real need that the diocese identified are the area of prevention of disease, and also discipleship is so needed. When we were at, I think it was maybe our first diocesan meeting, they were talking about how their clinic here had run out of drugs very quickly. And because malaria and typhoid are so prevalent in this area, and other diseases too, that what's happening is that they run out of these drugs, and then people have to go to somewhere else where they have to pay a lot of money. In the diocese, their clinic, they just have to pay 1,000 Sudanese pounds, which is for consultation, and then the drugs are free. But if they have to go somewhere else, they're paying 40,000 South Sudanese pounds or more, depending on what it is that they're treating. And so disease, prevention of disease, the bishop said, look, this has to be a key way to address this problem. Rather than simply treating people, let's make sure that prevention of disease is our key thing. And then discipleship is so badly needed. A lot of people in this area are illiterate because of the conflict. Education for a long time wasn't there. And so our primary school here, the local primary school, was built in 2012. The secondary school was 2018. And so education is beginning to come up. But because of that, there are a lot of people who do not know how to read or write. And so discipleship is so needed for people to be able to grow as Christians and to know how to be healthy as well. And so talking in the diocese, they felt that community health empowerment was a way to address those two key issues and many others.
Community health empowerment, or sometimes known as community health evangelism, or as we call it, CHE, is a holistic ministry. And the three elements of CHE are prevention of disease, promotion of health, and abundant life in Christ. At the moment, we are training a committee who will then select 20 people from the cathedral parish to be what we call CHEs, the volunteers who are going to visit the homes with a spiritual message and a physical message every week. So there'll be 20 CHEs and they'll each visit 10 homes. So that's 200 homes that are being visited every week with a spiritual lesson and a physical lesson. And considering that we've just done a week of witness, we've been round the homes, some of the homes have got 30 members living there, some have got 20 even, so it ranges from 6 up to 30. So potentially we can reach 2,000 people every week with a gospel message, with stories from the Bible, or whatever the spiritual lesson is, as well as helping them to improve their health. And so that's what we're aiming to do right now in the cathedral parish, and we're hoping that in the future to expand it out in the rest of the diocese.
When we were doing a CHE sensitisation in the cathedral, we saw quite quickly one of the impacts that CHE could have. When we asked the congregation to raise up their hands if either they or someone in their household had malaria in the past month, and then we said hands up if you had either you or someone in your household has had typhoid in the past month. About half the congregation replied to both of those. And then we asked how much they would spend, and when it came to malaria, someone said 45,000 South Sudanese pounds, and then when it came to typhoid, they said it's even more than that. And so we were trying to say to people that, look, don't think, as you maybe look at our skin, people sometimes think, well, is money coming into the diocese? Are you bringing money? And so we tried to challenge people saying, look, don't think about what's coming into your pocket, think about what's not coming out of your pocket. So if they have almost 100,000 South Sudanese pounds that they're able to use to develop their own life in a month, that's a lot of money. And when it comes to education, to be able to use that for education. Those who have children in school, they have to provide a ream of paper. Now, a ream of paper is 35,000 South Sudanese pounds. So imagine if they even prevent malaria, they're able to buy that ream of paper easily with what they've saved through prevention of disease. That's just one of the little impacts. That disease is one of the things that are keeping people poor. And if we want to see poverty, which is one of the key elements of sustainable development, if we want to see that being eradicated, we have to look at what are the things that help to keep people impoverished, and disease is one of those things.
So we really want to thank you for your support, for your prayers, for your financial support, and for your words of encouragement.
Yeah, it's been great to get messages from those in the WhatsApp group, and we get messages coming from those in CMS office as they've gone out and they've brought your encouraging words to us through WhatsApp. And so, yeah, we just want to say every blessing to you.